welcome back to another Brush Up on EMS with Bob. Today we're going to be talking about some respiratory disease processes and then some possible treatments that you can consider for each. It's going to be real quick going through some of these, so pay attention. Here we go. So COPD, it's a broad classification of a chronic lung disease. When we talk about COPD, we're not just talking about one individual. We're talking about an umbrella that goes over very different disease processes with names and how they work, but it's a chronic obstructive pulmonary disease. And we're talking about things like emphysema, chronic bronchitis, asthma, things like black lung. And smoking is one of the biggest causes here. So chronic bronchitis is under the COPD umbrella, and it's when the bronchial lining is inflamed. It has excess mucus production, and the cells in the bronchioles are trying to clear away that mucus, but they can't, and so it just starts getting accumulated, so they start having this cough, and the lungs are trying to expel that mucus, and so we have mucus in the alveoli. That's causing the gas exchange to not work very well, and so with not having that gas exchange, we have decreased oxygen saturations. They're having difficulty breathing. So it's not really a mechanical problem. All right, it's not really it's kind of both. It's not really a mechanical, it's not really an oxygen, it's both. We can't get the air in because of the mucus, and we can't get the oxygen in where it needs to go either. So that's why we have an obstructive pulmonary disease. Emphysema, the alveolar walls break down, and they go from having the normal alveoli where the air comes in and it reaches the capillary beds, and we go to more or less surface tension. And this results in carbon dioxide being trapped in the lungs, reducing the effectiveness of our breathing, and the lungs lose our elasticity. Asthma is that chronic disease that we see a lot of people using albuterol for, or Duoneb, and this is when those small bronchioles narrow and the mucus is being overproduced. So you're going to hear wheezing. If it's gone on long enough, you might even hear stridor. This results in small airway passages closing down and restricting that airflow. But don't think that just albuterol and Duoneb are the only things that are going to fix that. You need ALS, and they might need to consider doing epinephrine and mag sulfate for this asthmatic. But at the EMT level, we're just talking albuterol. With pulmonary edema, that's the fluid that we're going to have in the base of the lung. The lungs are getting filled up with fluid, and we need to get that fluid out. How do we do that? We use CPAP. CPAP's going to be positive pressure to push that fluid out to get it out of the lungs. We can also, at higher scopes, consider using Lasix or nitro to help push that fluid out back into the vascular beds. These pulmonary edema patients we can also consider as congestive heart failure. So, common signs and symptoms when you're like, well, how am I going to notice pulmonary edema? They're short of breath, they're anxious, they have pale, sweaty skin, they're tachycardic, they might even have hypertension. Respirations, because of that fluid being in the bottom of the lungs, are rapid and labored because they're trying to compensate. And because they have fluid, we're not getting oxygen going across, so they have a low oxygen saturation. You're going to hear crackles in the bases. You might even hear wheezes because the fluid is irritating the bronchial lining. And they might even cough up pink frothy sputum. That's because blood has mixed with the water in the sputum. So give them the high concentration oxygen in the pulmonary edema case, CPAP to push it back, and keep them in a decent position that they're leaning forward, that they can get that air movement. Okay, we don't want to lay them down and they'll feel like they're drowning. All right, pneumonia. How do we tell pneumonia in certain cases? We see pneumonia in nursing homes when they have a fever, they've got the crackles in the bases, and can be viral, and this can be bacterial, and it can be fungi affecting their lungs. So with this, they're going to be short of breath, they'll have some coughing, fever, and severe chills. They might even have some chest pain. But don't forget to rule out that they're not having a myocardial infarction. So treatment for pneumonia is just give them oxygen, transport them to the hospital, and just maintain them and don't let them go even more downhill. And then finally, spontaneous pneumothorax. That's when our lungs just, part of one of the lobes or part of the lobe deflates due to stress in the lining, due to a possible interior bleb that pops. But they're going to have sharp pleuritic chest pain. This is non-traumatic for the spontaneous pneumothorax. They're going to have decreased or absent lung sounds, shortness of breath, dyspnea on exertion, and low oxygen saturation, cyanosis, and then tachycardia. Why are all these things happening? They're compensating. Their heart rate's increasing because they're not getting enough oxygen. Their low oxygen saturation is causing cyanosis in their fingertips and their lips. And we have the decreased lung sounds because we have a lung that's not inflating. And we have to watch that and make sure that doesn't turn into a tension pneumothorax. Okay? CPAP's going to be contraindicated in these cases. There's some research being done on why, but at this point CPAP is contraindicated, but make sure we're administering oxygen to these people. And then one more, pulmonary embolism. Pulmonary embolism is a blood clot that has traveled up to the lungs, and once it reaches there, it causes chest pain and shortness of breath. So they're going to have sharp chest pain. If they've had a surgery within the last 3 weeks, that's a good indication that we might be dealing with a pulmonary embolism. Shortness of breath, anxiety, they're coughing, but they're not producing anything. Sweaty skin, so they're going into shock. Tachycardia, tachypnea, they're trying to compensate, and they've got some wheezing. Trying to differentiate pulmonary embolism out in the field is hard to do, but it's a good thing to keep at the back of your mind, and make sure that you're always giving these guys oxygen if they're under that 94%. So that's kind of a short rundown on respiratory emergencies. I hope this helps you guys. Take care.